Hello, my name is Ashley Reynolds, and today I will be going over mental health treatments and the stereotypes that lies behind them. Oftentimes when we're talking about mental health, there's misinformation about what treatments are offered and what the best treatments are for those given disorders within mental health. Let's take a look at some reasons. Let's start with what mental health disorder is. Mental health disorder is described as a syndrome characterized by clinical significance disturbance in an individual's cognition, emotional regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental process underlying mental functioning. Some common disorders that I wanted to touch on are going to be panic attacks, social anxiety disorder, generalized anxiety disorder, phobias, body dysmorphia, depression, PTSD, also known as post-traumatic stress disorder, and OCD, also known as obsessive compulsive disorder. These are just a few disorders that I wanted to touch base on because they are more commonly known. However, there are a whole bunch of disorders out there that we can look at where we can find those at in a minute. This is the DSM-5 chart. This is what I was referring to in the last slide. The DSM-5 stands for the Diagnostic and Statistical Manual of Mental Disorders. This is a great resource. It shows every single disorder that has been discovered, what characteristics of that disorder there are to diagnose it, as well as symptoms that come along with that disorder. The particular chart I have up right now shows the disorders that I had mentioned in the previous slide and the rates between females and males and what gender has higher percentage rate of that disorder. So as you can see, females tend to have the highest depressive disorder, where males tend to have a higher alcohol abuse level. A largely common stereotype that comes along with mental health treatment is that nothing can be done and it's just the way it is, which means people are not receiving the help that they can get. This means that they're not receiving treatment for their disorder, but in fact there's a number of treatments and medications that can be done and used to help with different disorders. It just may take time to figure those treatments out and figure out what works best for each person, because it's not one size fits all for treatments and medications for disorders. Some statistics that goes into that is 1 in 6 children and 1 in 5 adults experience a mental health disorder, but about only half of those people actually receive mental health disorder professional help in those areas, which is a large number. And with how accessible mental health treatment is, it should definitely be a lot higher. I just think because of the stereotype, people think that there's nothing that can be done, and that's what leads into these statistics, which will go on in more detail about later on. Treatments that are used is voluntary treatment and involuntary treatment. These are the two different forms to get into a regular treatment. Voluntary means that the person is going on their own to go find treatment, whether that be a therapist or other forms of treatment, which we'll go into in another slide. Involuntary treatment is when a person is mandated to go to therapy or to find treatment, and this is oftentimes required by the justice system after somebody had a rough patch in life. Some common treatments, like I was mentioning previously, is going to be psychodynamic psychotherapy. This is going to be primarily based on the childhood conflicts that then affects behavior, as well as the unconsciousness that affects the behavior of that current state. Play therapy. This is typically and primarily used with children. This approach allows children to play while they're with their therapist, and then the therapist can then go ahead and see how the child is reacting, and that is when the therapist can get all their notes. Behavior therapy. This gives a whole bunch of techniques to help with fears like phobias. Cognitive therapy, which helps the thought patterns that develop distress. Cognitive behavioral therapy, which is often used when people have eating disorders like anorexia or other disorders like that. And then the last common one is humanistic therapy, which is what often helps people with self-awareness. Some common medication groups are going to be antipsychotics. These are often used to treat people with positive psychotic symptoms. Atypical antipsychotic, which is used typically to treat people with negative symptoms of schizophrenia. Antidepressants, which is often used to alter the neurotransmitters. Anti-anxiety agents, which is used to depress the nervous system. Mood stabilizers, which is used to treat mania and depression. And then finally, stimulants, which is to increase focus and attention. These are all great medications that can be used, can be prescribed by either a psychiatrist, a therapist, or another person in that field. In addition to medications, there's also an entire area of holistic help that can be done, and that is people that don't particularly need an actual medication, that they can manage their symptoms with non-medicated things such as breathing techniques and meditation. I want to go in a little bit more about why I personally think the stereotype exists. I personally believe that the stereotype of nothing can be done surrounding mental health comes from the stigma about mental health, and a lot of people don't want to talk about mental health because they think it's a taboo subject. However, it is real, it is very common, and most people do experience these things. When we go to the doctors and we are trying to get help with these symptoms, if we're feeling anything regarding mental health, it is very common, especially in the younger ages, for us to get told it's just in their head or it's just in your head. But yes, some of the symptoms or some of the disorders are neurological. Not all of them are, and they're not just saying, "Oh, it's in your head," like that. They're saying like, "Oh, it's made up in your head," but that's not true. People are actually feeling these things, and personally, I have been a victim of this. When I was younger, I was told, after trying to get help about how I was feeling, the doctor was like, "Oh no, it's just in your head, you're just being a kid, whatever, you don't know what you're feeling." And in reality, there was actually something going on. It just ended up prolonging the diagnosis of it, and it actually made it worse in the end. Whereas if I actually got the help I needed when I was younger, it wouldn't have been as bad as it is when I was adult, when I finally got diagnosed, because there is something going on. It's not just in our heads. Some help for mental health disorders that I personally like to recommend is Grow Therapy. This is a website that allows you to choose either in-person or online therapy, and the website allows you to get help finding medication that fits you best, as well as you're able to select the therapist that fits you best depending on what you're looking for. Additionally, most healthcare providers will allow and help you find the best therapist as well as treatment for you. My final thoughts for today is, with the knowledge I've learned from this course, I will be able to guide someone who has the stereotype that mental health disorders are just in people's heads and nothing can be done, to better understand why that is false, and how there are so many treatments and medications that are available to help people with these disorders. I've also gained a better understanding that if you have a mental health disorder, it doesn't mean something's wrong with you. It just means you need a little extra assistance in those areas, especially given how common these disorders are. Thank you everyone for watching, and I hope you learned a little bit more about the stereotype and breaking the stereotype of nothing can be done, with how accessible and easy it is to find help as well as get medications. Thank you for watching. And lastly, here are the resources I used for today's presentation.